Hey everyone, Dr. Mike here. We all love a good smooch, right? It's a beautiful expression of affection, but did you know that a simple kiss can transmit serious diseases? Some can last for days, others for life. That's right, even though it's often considered taboo to talk about, it's important to be aware of the health risks associated with kissing. In this video, we're going to dive deep into the world of infectious diseases that can be spread through saliva. We'll cover everything from the common cold to more serious conditions like meningitis. We'll discuss how dangerous these diseases are, how long they last in the body, and most importantly, how to protect yourself. So buckle up and get ready to learn something that might just surprise you. Let's get started. Let's talk about a really common one. Herpes simplex virus type 1, better known as HSV1 or oral herpes. Now, before you freak out, it's important to understand that HSV1 is incredibly common. In fact, the World Health Organization estimates that over 3.7 billion people under the age of 50 have it. HSV1 is usually spread through contact with saliva, often through kissing. Once you have HSV1, it stays in your body for life. Don't worry, most of the time it remains dormant, meaning you don't experience any symptoms. However, sometimes HSV1 can reactivate and cause those pesky cold sores or fever blisters around the mouth. These sores can be painful and embarrassing, but thankfully they usually clear up on their own within a week or two. Now here's the thing. Even if you don't have any visible sores, you can still spread the virus. That's why it's crucial to be mindful of your own health and practice safe kissing habits. If you know you have an active cold sore, avoid kissing or sharing utensils. And if you're unsure about your own status, it's always a good idea to talk to your doctor about getting tested. Remember, knowledge is power when it comes to protecting yourself and your partners. Stay tuned because up next we're going to discuss another common kissing culprit, mononucleosis. You won't want to miss it. You've probably heard of mononucleosis, or mono for short. It's often called the kissing disease because it's primarily spread through saliva. But don't let the nickname fool you. You can also get mono from sharing drinks, utensils, or even being coughed on by someone who's infected. Mono is caused by a virus called the Epstein-Barr virus, or EBV. Like HSV1, EBV is incredibly common, and many people get infected with it during childhood. Now, here's the thing about mono, it can really knock you off your feet. We're talking extreme fatigue, sore throat, swollen lymph nodes, and even fever. These symptoms can last for weeks, and in some cases, even months. So, what can you do to protect yourself? The best defense against mono is good old-fashioned hygiene. Wash your hands frequently, avoid sharing personal items, and if someone you know has mono, steer clear of their saliva. Up next, we're diving into a lesser-known virus that can be spread through kissing cytomegalovirus. Stay with me, folks, this information is crucial. Now, let's talk about a virus you might not have heard of before. Cytomegalovirus, or CMV for short. CMV is a common virus that usually causes no symptoms or mild flu-like symptoms in healthy individuals. However, CMV can be serious for people with weakened immune systems, pregnant women, and their unborn babies. In these cases, CMV can lead to complications like pneumonia, hearing loss, and vision problems. So how is CMV spread? You guessed it, through saliva. Like other viruses we've discussed, kissing, sharing utensils, and even close contact can transmit CMV. The good news is that for most healthy individuals, CMV is not a cause for major concern. However, it's important for pregnant women or those with weakened immune systems to be aware of the risks and take precautions. Speaking of common infections, let's move on to the ones we're all too familiar with, the flu and the common cold. They might not be as surprising, but they're definitely worth discussing. Stick around. Okay, let's talk about the usual suspects. Influenza, better known as the flu, and the common cold. These respiratory viruses are notorious for spreading like wildfire, especially during certain times of the year. Both the flu and the common cold are highly contagious and easily spread through saliva and respiratory droplets. Think about it. A simple kiss can transfer those tiny virus-laden droplets directly into your mouth and nose. Now, while most people recover from the flu and colds without any issues, these viruses can cause serious complications, especially in young children, older adults, and people with underlying health conditions. So how can you protect yourself from these unwelcome guests? Washing your hands frequently, covering your mouth and nose when you cough or sneeze, and avoiding close contact with sick people are crucial steps. And of course, getting vaccinated against the flu every year is one of the most effective ways to protect yourself and those around you. Up next, we have a more serious infection that can be spread through saliva meningitis. Stay tuned to learn more about this potentially life-threatening disease. Now let's talk about a more serious infection that can be spread through saliva meningitis. Meningitis is an inflammation of the membrane surrounding the brain and spinal cord. It can be caused by bacteria, viruses, or other organisms. Bacterial meningitis is particularly dangerous and can be life-threatening if not treated promptly. Viral meningitis is generally less severe, but can still cause serious illness. Kissing someone who is infected with certain types of bacteria or viruses that can cause meningitis can put you at risk. Symptoms of meningitis can include fever, headache, stiff neck, nausea, vomiting, and sensitivity to light. If you or someone you know experiences these symptoms, it's crucial to seek medical attention immediately. Early diagnosis and treatment are essential for improving outcomes in cases of meningitis. Prevention is key, and there are vaccines available that can protect against some of the most common causes of bacterial meningitis. Let's move on to another common but painful infection, strep throat. Don't miss out on the next chapter. Now let's talk about a condition that many of us have experienced at some point, strep throat. Strep throat is a bacterial infection that causes inflammation and pain in the throat. As you might have guessed, strep throat is highly contagious and can easily spread through saliva. Kissing, sharing drinks, or even inhaling droplets from an infected person's cough or sneeze can transmit the bacteria. Strep throat typically causes a severe sore throat, pain when swallowing, fever, and swollen lymph nodes in the neck. While it might seem like just a bad sore throat, untreated strep throat can lead to complications like rheumatic fever, which can affect the heart, joints, and other organs. The good news is that strep throat is treatable with antibiotics. If you suspect you have strep throat, it's important to see a doctor to get tested and receive appropriate treatment. Up next, we're discussing another infection that can be passed through kissing oral thrush. Let's talk about a condition that might not be as well known, but is certainly something to be aware of. Oral thrush. Oral thrush, also known as oral candidiasis, is a fungal infection that occurs when an overgrowth of the fungus Candida albicans develops in the mouth. While Candida is a normal part of the mouth's microbiome, certain factors can upset the balance and allow it to grow out of control. This can lead to the development of white patches on the tongue, inner cheeks, and sometimes the roof of the mouth, gums, and tonsils. Oral thrush can be spread through saliva, making kissing a potential route of transmission. It's more common in infants, older adults, people with weakened immune systems, and those who use certain medications like antibiotics or inhaled corticosteroids. While oral thrush is usually not serious, it can cause discomfort and difficulty eating. Treatment typically involves antifungal medications. And finally, let's address the elephant in the room, HIV. Can you really get HIV from kissing? Stick around to find out. Now let's address the question that's probably on your mind. Can you get HIV from kissing? The answer is not as straightforward as you might think. HIV is a virus that attacks the immune system. And if left untreated, it can lead to AIDS. HIV is primarily spread through contact with infected bodily fluids like blood, semen, vaginal fluids, and breast milk. Now, saliva does contain a very small amount of HIV, but it's not enough to transmit the virus. The enzymes in saliva actually help break down HIV, making the risk of transmission through kissing extremely low. However, there are some very specific situations where the risk of HIV transmission through kissing might be slightly higher. For example, if both individuals have open sores or cuts in their mouths and there's blood present, there's a theoretical risk of transmission. But it's important to emphasize that the overall risk of getting HIV from kissing is extremely low, even in these specific situations. The main routes of HIV transmission remain unprotected sex, sharing needles, and contact with infected blood. So, while you don't need to swear off kissing forever, it's always a good idea to be mindful of your health and practice safe habits. That wraps up our discussion on the shocking diseases you can get through kissing. Now let's recap some key points. So, there you have it, folks. We've covered a lot of ground today, from common colds to more serious infections. The main takeaway? Kissing can spread more than love. It can also spread diseases, but don't let that scare you away from showing affection. The key is to be informed, practice good hygiene, and be mindful of your own health and the health of your partners. Remember, communication is key. If you found this video helpful, don't forget to like, comment, and share. And of course, hit that subscribe button for more health tips. Stay safe, stay healthy, and I'll see you in the next video.